Joining us now is Dr. Maja Artandi with Stanford Health Care to talk about the very latest in coronavirus developments. Thanks for being here this morning.
It's great to be here. Thank you.
Let's talk about this disturbing report that came out last week, the first reinfection of somebody. And it seems like the second time this person was infected with COVID-19, it ended up worse. What does this tell us about immunity and how bad this virus can be?
Yeah, let me tell you about the patient. So the patient is a 25-year-old man from Nevada, and he got sick in April. He had a cough, nausea, didn't feel too terrible, but then went to the doctor and got tested for SARS-CoV-2, and he tested positive, so he had COVID-19. He quarantined at home, he got better, and completely recovered, and even in May, had another COVID test that was negative. Now, at the end of May, he started to feel sick again. This time he felt a little bit worse. He had cough, nausea, dizziness, a headache. Went to an urgent care center and told them that he was sick. He was not tested for SARS-CoV-2 at that time because we typically don't do that because we're like, well, you had it less than 3 months ago. You probably don't have it again. He got even sicker and then eventually a week later ended up in the hospital. And in the hospital, they tested him for SARS-CoV-2 and he tested positive again. Now, how do we know that this is actually a second infection and not a reactivation of the first infection? Because that can happen too. And so luckily, the researchers kept the sample from the first infection in April, and then they could compare that to the one from June. And there were enough differences between those two viruses. They're still both were SARS-CoV-2, but they had the second one looked different from the first one. And so they concluded, yes, this is definitely a second infection. Now, if we hear the story, we're probably all worried, oh my goodness, how can that happen? Are we all getting reinfected? And this is really scary. Unfortunately, it's quite rare. Currently, there are more than 38 million people around the world who had or have COVID-19, and we have so far only 5 documented cases of reinfection. And this gentleman from Nevada was the very first case in the United States. Now, granted, it's really hard to prove that someone has a reinfection because you have to have the sample from the first infection and then compare it to the second time. And only very advanced labs and hospitals can do it. And most of the second infection, not in this case, but most of the time, the second infection we think is much less severe. So people often don't even seek medical attention. So they might have the sniffles and they're like, well, okay, it's just a cold, and they don't go to the doctor. Why do people get second infections? We don't really know. There are several hypotheses. Hypothesis number 1 is the first time you just didn't get it badly enough to mount an immune response, or your immune system might not be as good as it should be because you are medications or you have an underlying condition that suppresses your immune system. Another theory is that the second time you might have been exposed to such a large amount of virus particle that just overwhelmed the immune system. I think what we can take from this study, though, is wear your mask. Even if you had COVID, continue to wear a mask because you might get it again.
So what's disturbing about that is that we don't have the hope of being immune once we have come down with COVID-19. It kind of blows the whole theory of herd immunity out of the water, or doesn't it?
Herd immunity is complicated. I always say the immune system is incredibly complicated. And we don't, again, really know what happens when someone gets this infection. Herd immunity is risky because in order to have herd immunity, you have to have 50 to 60% of the population immune. And in order to get that, many people will die or get really sick. So I don't think herd immunity for this virus is a good idea. I think the vaccination is a much better idea.
All right, speaking of the vaccines, the trials that are ongoing have ran into some snafus over the last week or two. One person getting seriously ill. What do we know about that person and where things stand?
So the vaccine that we're talking about is a vaccine that's made by Johnson & Johnson. And this vaccine actually does not need to be frozen, and it only needs 1 shot compared to the other vaccines that need multiple shots, which is great because it's much easier to store. And if you only need to give everybody 1 shot, we'll be much faster done with giving everybody immunity. Now, the trial that we're talking about tests this vaccine against a placebo. And Johnson & Johnson started this trial several weeks ago. Their plan is to enroll 60,000 people worldwide. And those 60,000 people then get randomized to either getting the vaccine or getting the placebo. Last week, this trial was paused because one study participant got seriously ill. And that's all we know. We don't know anything more. We don't even know if he got the vaccine or the placebo. So let me explain a little bit more what that means. So vaccines, it takes a long time to make a vaccine. And at the end, vaccines have to undergo large trials. The last trial is called a phase 3 trial. And a phase 3 trial, they have thousands, tens of thousands of people, and they get randomly assigned to either getting the vaccine or a placebo. And this time an injection with a saline solution, probably. Neither the patient nor the doctor know what the patient got. And then after the patient got the injection, they are very closely monitored. They have weekly or monthly doctor's appointments, they get blood work, and they also have a daily journal where they have to write down everything that they feel. And they have to write down, oh, I have a headache today, or I have a little rash, or I have nausea. For those minor symptoms, the trial will not be paused. But if the one volunteer has a much more severe symptom, that's called an adverse event. And that then needs to be reported to the company. And the company reports it to the FDA and also to a board of independent advisors. And then the company and the board of independent advisors decide if they need to pause the trial. And they will decide that based on the seriousness of the adverse event, even before they know what the study participant got. They don't know if he got placebo or she or the vaccine. Then they do some investigation. So the advisory board then finds out, oh, is that a placebo or is that a treatment patient? If it's a placebo patient, of course, we know it's a side effect from the drug. So then the trial can get started again. If it is a treatment patient, then the advisory board needs to figure out if it was really the drug that caused it or was it something completely different. And that's why the trial is paused right now. Now, I actually think it's a great thing this trial was paused because it tells us that the FDA and the advisory board take their job very seriously. There are 60,000 people in this trial. It would be really weird if nobody had any significant adverse events or something unrelated to the drug. So that the trial was stopped tells me that even though certain politicians put a lot of pressures on the company, they take their job seriously. And once we have a vaccine, we can rely on that vaccine being safe.
Okay, that's very good news. I want to circle back to something we talked about a couple of weeks ago, the virus living on surfaces, and thinking that maybe that wasn't as much of a concern as we thought at the beginning of this outbreak. Well, then there's new research coming out saying it can live for up to a month on surfaces like your cell phone. Does that raise any red flags or any concerns on that?
I don't think it should raise any concerns. So you're right. A couple of months ago, there was research out that the virus can survive 3 to 6 days on certain surfaces. Now, recently a study out of Australia got published, and they said, oh no, the virus can survive for 28 days on the glass of your cell phone. That is really under fake conditions. Those are not real world conditions. For me, it seems like the researchers have a competition who can make the virus survive the longest. So we know the virus doesn't like UV light. So they kept the virus on the surface in the dark. We know the virus doesn't like high temperatures. So it was a perfect 68 degrees all the time. It was perfect humidity, no wind, nobody touched it, and it was also in a virus medium that the virus really likes. So absolutely not real world conditions. We have so far not seen, I'm not aware of any cases where the virus was transmitted through surfaces. Theoretically, though, it could happen. So if someone who has COVID-19 sneezes on a surface and someone else an hour later touches that surface and then picks their nose, potentially they could get the virus. So again,
it's a lot of bad behavior on several people.
There you go. So we need to wear a mask, we need to wash hands, and don't touch our faces, which we said all along.
Okay. Dr. Maja Artandi, you're always good for a reality check. Anything else you want to share with us today?
Wear your masks. That's it.
Okay, very
All
good.
right.
Doctor from Stanford Health Care, thanks.
Good to see you. Bye.